Good morning. First of all, I would like to thank Dr. Virendra Agarwal for inviting me to participate in this course on optimizing IOL selection for ideal visual outcome. So my topic is spherical and aspherical IOLs. How to select among these two categories, and how to do workup to find out the best visual outcome. As we all know that we have witnessing the new age of the refractive cataract surgery, and with the availability of the femtosecond laser cataract surgery, the incisions are customized. You can address the pre-existing astigmatism. The diagnostic tools are available, such as Hoya iTrace, where you can find out the corneal aberrations, and the IOL technology is available, viscoelastics are available. So because of the availability of the various tools and technology, more and more surgeons are doing younger cases with larger people, and these cases who are undergoing cataract surgery are more active, they are more demanding, still driving, working, and the outcome is improving. So we should we should use these tools to improve the outcome. So coming to the IOL consignment, with the availability of the IOLs in our OR. So these can be traditionally divided into major categories: traditional IOLs and aspheric IOLs. The traditional IOLs, they induce the positive aberrations. The aspheric IOLs, this technology is very well established now. There are a lot of data in the literature which witness the benefit of the using aspheric IOLs. So these can be classified into two parts: zero aberrations and the negative aberrations. In this category, the Bausch and Lomb Soport lens is available. With the negative aberration, we have Technis and Alcon and Hoya lenses. So this is the photograph showing the conventional versus aspheric IOLs. So what are the limitations of the conventional IOLs? Like these IOLs have inherent positive spherical aberrations, and they add to the corneal positive spherical aberrations and further degrade the image quality. And if there is a decentration or tilt, the aberrations can increase with the conventional IOLs. And the negative spherical aberration IOLs is introduced, and the goal is to neutralize the positive spherical aberrations of the average cornea. Then the question is need to address is how important is asphericity. Can patient really tell the difference? And it is worth trying to customize it for every individual. So the first question, can patient really tell the difference between the aspheric and aspherical IOLs? So yes, under low contrast conditions such as driving at dusk, and patients with large pupil will more likely to notice the difference. And the power of the implant also matters. If the hyperopic patient requires plus 30 diopter implant, and the standard lens will induce more positive spherical aberrations than the patient who is undergoing IOL implantation, like myopic cases who needs 10 diopter power. So this is the photograph showing the spherical aberrations. You can see the rays are focused here, and the rays are diffused. So as we all know that in young eyes, the positive corneal aberrations, it is neutralized by the negative spherical aberrations of the lens. So this is the corneal positive aberrations in the young eye. You can see the positive corneal aberrations. And the lens, if you see, this is negative spherical aberrations, and once we cross the age of 45 years, it becomes positive. So there is a whole eye, there is a more positive spherical aberrations. So once we put the implant the lens with the standard lens, there is a further increase in the spherical aberration of the eye. So in order to address this issue, the aspheric lenses have been introduced, and they can be classified according to spherical aberrations or according to the aspherical surface. So as I mentioned you before, there are two categories: are zero spherical aberrations like Bausch and Lomb Soport lens, or negative spherical aberrations such as AMO Technis lens or Acryso IQ lens falls in this category. And You can also classify aspherical lenses according to the aspherical surface. For example, anterior aspherical surface is there on the Technics lens, and posterior aspherical surface is present on the Acris of IQ lens, and both surfaces are aspherical in the Bosch-Lomb lens. So currently AMO Technics is designed to correct plus 0.27 micron of the positive spherical aberrations of the cornea. This lens has minus 0.27 diopter of this the asphericity, and Acris of IQ and Hoya lenses, it corrects 0.021 micron, and the Bosch-Lomb has zero spherical aberrations. So when it's crucial to implant the aspherical IOL, with the increasing demand for perfection, it's very important. You should try to implant the aspherical aberrations, and in patients with larger patients who are leading active lifestyle, particularly night driving, and the previous history of refractive surgery. So this photograph shows the depth of the field and spherical aberrations. In the real world, there is a improvement, reduction in the contrast sensitivity with the spherical IOLs, and with the improvement in the contrast sensitivity with the aspherical IOL implantation. In practical terms, nowadays positive spherical IOLs designs are less preferred, except with some cases of who has undergone post hyperopic LASIK cases. You can try to implant these spherical IOLs in some cases of post hyperopic LASIK cases. And negative spherical aberrations designs, they provide the best image quality, but the depth of field is less. If the good centration, and the centration is very important in these designs, because it should center well. And the Bosch-Lomb aberration free designs, it provides good image quality, good depth of field, and centration is not critical. So this is the decision tree for the IOL selection, and once the case of any case comes for cataract surgery, if the case has not undergone prior corneal refractive surgery, and there is a less likelihood of the IOL decentration, and the image quality is critical, then you go for the aspheric IOLs with the negative spherical aberrations. And if there is a chances of lens decentration is there, for example pseudo exfoliation, then you can go with the aspherical IOLs with the zero spherical aberrations. And post hyperopic cases, you can always go for traditional IOLs with positive spherical aberrations. And in the prior myopic LASIK cases, you can go with the aspherical IOLs with negative spherical aberrations. And if the depth of the field is very critical, then you can go with the aspherical IOLs with the zero spherical aberrations. So in summary, in the current era of the press myopic correcting intraocular lenses, toric IOLs and aspheric IOL technology, their practice milieu is changing. Informed consent takes on new meaning when the surgeon and patient decide together which IOL technology represents the best fit for the particular lifestyle and for the particular visual outcome. And customizing IOL is no longer optional; it is essential to the practice of refractive cataract surgery. So, and we have tools are available such as eye trace, where we can selectively calculate the corneal aberrations, and we can customize the lenses based on those technology. Thank you very much.
Thank you.